help us keep ourselves safe and the patient safe. So we're going to use appropriate procedure for cleaning, closure, dressing of wounds, and identifying when to refer if necessary. So some supplies you'll need are gloves, sterile water, 10% betadine solution, antibiotic ointment, an applicator, steri strips, non-stick glue, pre-wrap, tape to close it up. So general wound care. So we want to put on gloves and then follow our OSHA standards. So discard of any bloody utensils into biohazard bags. And then we want to control the bleeding by covering the wound with sterile dressing and applying direct pressure to the bleeding. We want to irrigate the wound if it has debris, dirt, grass, anything like that. You want to irrigate it with either saline solution or water. And then we can clean the wound with 10% betadine solution. So non-gaping wounds, you want to apply an antibiotic ointment with an applicator, cover the wound with non-sterile dressing, secure gauze with stretch tape, and then dispose of contaminated items in the biohazard bag. So that's pretty easy. But then talking about gaping wounds, you want to approximate the wound margins with steri strips, and then you will cut the steri strips to size, place the steri strips perpendicular to the wound. So if the wound is going down like this, you want to go across this way. And then you will overlap the steri strips by half, pulling the wound back together. After this, you want to cover the steri strips and then dispose using motion propulsion. So wound care management. Does anyone know any signs of infection that you need to look out for? Yes? Redness.
Swelling or heat.
Okay, swelling and heat.
Running.
Okay.
Or plus.
Us. Anyone else?
Loss of function.
What did you say? Another big one to look for is like red streaks will go up the wound. So look for the red streaks. That's a big one. Discharge. The patient will have a fever. So we want to keep the wound moist and warm and clean, not warm. Also, we want to instruct the patient on signs of infection, so stuff that we just named earlier. And then we want to instruct the patient on how to clean their own wound and how to dress it. So if we're not there, they can do it. And then also, we want to protect the wound during practice and competition. Any questions? Yes.
So, say someone gets cut with a sharp object, could be a laceration.
Yes, that could be a laceration. But most likely in sports, we will see it with a direct blow. But you're good question. Any more questions?
How would somebody sustain an avulsion? Wait, did you just ask about avulsion?
No, he didn't.
How do you sustain an avulsion?
So an avulsion could be in sports, like take for instance football. If you're blocking someone, someone's fingernails can get caught and ripped back this way. They can get caught on equipment. Their skin can get caught on equipment and pulled back. Those would be most likely to do. Any more questions?
How do you do the steri stripping?
I can actually show you when we do our lab activity. But the steri strips are sticky strips about this long, and you'll cut them to the size of the wound. So you apply a stick agent on one side and place the steri strip down, close the wound, and you're going to pull it over to make sure you close the wound. So the thought behind it is closing the wound so it can heal better. This also helps with scarring.
When you have a wound, is there any time where you wouldn't use like the betadine or the antibiotic ointment?
Sometimes if it is just a basic wound that you're not concerned with, you want to always make sure you clean it with soap and water. And then if you want it to air out and heal, then you wouldn't put any ointment on it or any betadine. But if it looks questionable and looks deep enough, you can use it.
What is betadine?
Betadine is a cleaning type solution. So I have an example right here. It's this color, it's kind of darker. And so it's 10% iodine, it's antiseptic, non-sterile solution. So it's just a cleaning agent and it kills the bad stuff but not the good stuff. So you want to stay away from peroxide because that kills the good stuff and the bad stuff in the wound.
Alcohol?
No, no alcohol either. That also kills the good healing agents that we want to come to the wound healing.
When someone has a wound, are all 3 layers of the skin being affected, or does it depend?
Good question. Not always. It depends. So an abrasion, it'll just be that top layer. A puncture wound will probably go to the subcutaneous level depending on how deep it is. But that's also you need to recognize to see if they need stitches to refer or not. So if it's just an abrasion, you can handle it yourself, but you just need to know what to look for and how deep it would be to send to someone else.
Are there any areas that you would be more inclined to send somebody for, even if it's a minor one, just to check?
Yeah, usually their face, just because scarring happens on the face and you want to, if it's going to be on their face or here the whole rest of their lives, you want to make sure they see someone to get a second opinion on it. Yeah. You guys want to move on into the lab activity? Nice. Okay, so we'll break up into different groups this time.
We like what we got to know our people.
I didn't even know
Okay,
what
you
their
can-
favorite ice cream.
You can stay in the same group and No, you're fine. Okay, so everyone get a partner. And you, with this Sharpie, we're going to draw a wound on your body, and your partner is going to dress the wound.
What's going on?
You're going to draw a wound on your body, and your partner is going to dress the wound. Okay?
So,
It is your face.
Does not come out.
Do I want blue?
Okay?
Are we each doing it?
You each are doing it, and then one person go first, one person go second. And you can draw an abrasion, a puncture wound, a laceration, any kind of wound you want.
my arm.
This is
come off.
a wound where you're quiet.
Yeah, these are quiet. So remember your OSHA precautions. So put on gloves is the first step.
Can we draw our partners on
Can
them?
we
Yeah, sure.
pretend that we have the surgery?
Yeah.
I don't know.
And I'm
Where
gonna
do you,
pull up.
where do you want to wound?
I'm gonna pull up the steps over here if you guys get confused.
What kind of wood is that?
Black spot.
Chunkier skin.
No, you don't have to color the whole thing.
It's gonna be bloody.
No.
Probably dress it. I wanna learn.
I thought that, I almost did it, and I was like,
What happened?
what happened to me? I got off the bus, this man rocked me from my
Are we
car.
like switching
What
tables?
happened to you?
Oh, you guys need stuff too.
I was-
Yeah, for Starburst.
What?
Okay,
Yeah,
here you
getting
go.
off the bus.
Wait, is this your room story?
I won.
You guys, here's some. You can pass that back this time. Pass some daily. Here's some gauze too.
Wow. Did we not use my gloves?
Wow, possessive much? What do you mean?
You don't need extra large gloves.
Maybe she does. Maybe she does. Maybe her hands swell with this sweat.
Those are really big gloves.
They're extra large. They're for my hands.
Can we pretend that we are?
If you guys need more, any different materials, let me know and I can pull some.
I know.
Yes.
I'm gonna
Yeah,
have
you
to.
can use this bloody one.
That medium gloves.
OSHA standards. OSHA.
Yeah, we have to dispose of them.
I'll get you guys the biohazard bag and dispose of your materials.
So you got a wisdom.
Okay, this is the biohazard kit. When you're done, dispose your stuff in your.
It's that show. That's a limp wound.
Need supportive blowing.
That's soft, Jesse.
Puncture wound.
That's soft.
Right. I was running with scissors.
Here's some power flex too.
Okay. Is it bad if it's deoxygenated blood?
We're done. Go into the ER.
Wait, I have a question. What if you're holding it and it bleeds through? The gauze, do you take it off? and
No,
then-
don't take it off, just add more gauze to the area.
Why adjust her wound now?
So, okay, so what
Oh,
was
she
your
took the
wound?
gauze, or the...
laceration.
Okay, and you did steri strip and
I borrow that?
you are.
Like irrigating?
Okay. Yeah, so if you refer him, now it's switch.
So, sorry. I would control the bleeding if there was a lot of bleeding. I would do either the betadine solution to clean up
Or saline.
or saline,
Yeah.
and then stir strip it and then refer.
And then refer, yeah, and you can close the steri strip too if you want. You can put it like a over it and
Well, it's my
then wrap it. But
Not next month.
sure, if you think it's deep enough, you use your judgment and
Hey,
refer.
ready to go back in?
Yeah, that's what I was.
Oh no, you bled through.
Just,
That's nice.
I would help you, but I don't have gloves on.
I'm glad you're afraid.
Would you just like cover it and close it, or do you like? What do you?
Yeah, avulsion, you really want to be careful with infection, but I would get the skin as flat as possible. A lot of times it's not hanging on.
Yeah. So you just kind of put the skin back and then cover
Yeah,
it.
clean it, cover it, and then glove over it. Yeah. Or if not, that.
know what.
Think of it like a blister.
Yeah.
T-shirt.
Maybe the one where
Yeah.
it's just like at the top.
I would be careful on the hand, since it's such like a.
So what's going on here?
Look how good it is. Yes. Students.
Or duration.
Yeah.
Student.
Oh, yeah. How do we take the gloves off if
They're bloody.
contaminated?
Okay, so a good way to take a glove off is you get this side and take it off. Oh gosh. And then read it. Okay, yeah.
Looks like you got a laceration going on there. Go ahead and get some.
So you take this one
Gas.
and start taking it off slowly, but not all the way, and roll it up, and then also grab the other glove in it too and put it inside.
Go ahead and just use this.
Does that make sense? Here, I'll put it
You got apply some
Can I use
pressure.
your glove?
Oh no, it's bleeding through. I need some more gas.
Oh, okay.
Wound care.
Can I get some?
Yeah, here you go.
Oh, I need gloves. It's okay.
Yeah, I need to cover it.
Is there a disposable bag?
Here, you can use mine too. Okay, this is how I take mine off.
Can you hand me that saline solution, please?
This is how I take mine off. She's wounded.
Okay, go ahead.
All right, ready?
Yeah.
Washing out with saline solution.
And then hold this one.
All right.
All right. Haley, you missed it.
Am I gonna lose my finger?
Yeah, probably.
Tell me that.
And then roll it up in that one. Yeah.
Hey, Katie.
Yes.
So, a laceration. This professor, Katie. Her laceration off her finger. How would I cover this up?
Good question.
It's long. I don't have to.
This is how you're
It's like
supposed to.
Guys.
How deep is it?
I've used my own
Get a
gloves.
white meat.
It's good for profusely bleeding. All right, stop the bleeding first.
I did.
Okay, and then it's still bleeding or no?
Yes.
Do you think it needs serious strips?
It's awfully close to that.
Probably. So I do stairs and cover the bed.
Yeah.
And what's called
Yeah.
social services.
There's a dog.
Oh, the dog.
Stop the bleeding first. Your first goal is to stop the bleeding. If you can't stop it, then you add. Would you do no? So you never want to take the gauze off. You just add more. If that bleeds through, add more. Yeah, and really try to get it. Okay, so finally stop. You better put that in the side.
No. Profusely
Your
bleeding
first step
over
is to
here.
control the bleeding. If the bleeding isn't controlled, don't try to finish the wound.
Right.
You hear me, guys? The first step is to control the bleeding. We control.
What's the benefit of holding an arm up like this? Or like
So-
the limb or area that is
Right, so if you want to stop the bleeding, if you hold it up, the blood's not rushing to that area anymore. It's trying to go back into the heart. So if you elevate the area, it'll lessen the blood flow. So raise the limb, add pressure. Don't remove the gauze, but just keep adding more gauze in order to keep it going.
Alright.
Blood through, I think it's
Yeah.
necessary to insert
amputation?
stitches.
Just stitches? We don't have to amputate?
No, it's not.
Okay.
In my gloves.
But we need to do this.
Okay. Just the area strips?
Bleeding stock.
We're going directly
The
here,
bleeding stock, so we're going to use some
Good plan.
saline.
unless we need to go get some food
Nah.
before.
Ice cream?
Ice cream.
Not
Just not
Neapolitan.
Neapolitan.
I love Neapolitan, that's my favorite ice cream. I swear.
And then we're going to
Oh, that's a terrible choice.
Yeah.
apply a sticky agent on the
That's so good. He likes Neapolitan.
Who does?
Can I take this off?
It's one of my favorites.
Yes.
It's good. You had the Neapolitan shake from it now?
Actually, wait. Oh, no, you don't. I'm just talking to you. I've never had it about it.
Oh,
Did we ever find out that was true about them making a
whoa, sir, biohazard. Come on. OSHA would find
Like,
you.
I thought it was an April Fool's thing, but the video I saw was posted on like March 26th.
So the people in the video, his friends were in the video, and his friend was like, yeah, it's real. And he did.
What?
He said,
Let's do about 3 more minutes of the wound care, and then we're gonna clean up.
should I cover it with a steri strip?
I'm sufficiently cared for.
I usually like covering the straight.
I'm good.
Yes.
So after I apply the steri strips,
What
do I
happened to
want
you?
to put a Band-Aid or something over that?
I like doing non-adherent and then power flex. And then
I got enough
refer.
of that.
If you steri strip, you're usually always gonna refer. Because you're concerned with the deep.
So this is
And then I tripped and fell.
Okay, so the